Welcome back to West Texas View.
Up here too. Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Leslie Chupp has been talking to us about the Laura Bush Institute for Women's Health and the Jenna Welch Centers. And I think I've confused everybody because I misspoke and said that it was located at the Midland College, but that's not true. And also, there's a difference in the concept that you need to understand about the Laura Bush Institute for Women's Health. So just get it all straight for us.
I'm going to try. It is a little bit complicated, but the Laura Bush Institute for Women's Health is a multi-campus Texas Tech organization that promotes women's research in health topics, community outreach, and educational type projects. And that's we have that organization in Lubbock, in Amarillo, here at the Permian Basin. I think they just opened one in Abilene.
But you're in charge of all of those.
I'm the director of the Regional Campus Institute, which is here in Permian Basin. And my office is actually in Midland, in the new Midland Physicians Building. That building just opened up in April, and we see patients, internal medicine patients, family medicine patients, and the women's health portion of that building is named after Jenna Welch, and that's the Jenna Welch Women's Clinic or Women's Health
And
Center.
that's the one you just had the opening
That's
of,
the one
and
we had
Laura
the dedication
Bush came
ceremony.
down for
Yes,
that.
yes, Laura Bush and her mom, and we had a dedication for that particular portion. But we've been up and running since about April, seeing patients, and there's several doctors there, and we're going to get more and do more things and grow our women's health services over time.
And when we're talking about women's health services, we're talking about from puberty to all the way
absolutely.
to
absolutely. We have
senior citizens.
Yes, we start with teenagers, and that's where we can really make a big impact. I know you talked to Dr. Mitchell, and prevention is
key.
Very, very important. We can stop hopefully smoking and other risk behaviors early. Teen pregnancy rates are really high in West Texas. We can do something about that with some prevention. So we want to target that group. But then we go all the way through, pregnancy, childbirth, problems with bleeding, pelvic cancers, everything. And then, of course, menopause.
And the sexually transmitted diseases that have just made a big negative impact on our young people.
Yes.
And but what is your vision for the Jenna Welch Center, for example? Is it just to grow and reach more and more people, or do you expect it to eventually have satellite places out in other areas of West Texas, or what?
Well, my vision is for us to provide, like I said, some very specific quality niche services that we have already really good providers here in Midland and Odessa that do a great job with healthcare that are in private practice. But what we want to do is provide some of those services that you might not get in a smaller town or a rural area, and target some very niche areas. I don't know about actually going out to the rural clinics or the rural areas. That would be a wonderful thing to be able to do at some point, but definitely have a referral base where people don't have to travel to Houston or don't have to travel to Dallas to get the things that they may have had to do, previously.
So their doctor in Seminole could refer them here.
Absolutely, and a referral area for more complicated conditions or things that are more difficult to treat or maybe diagnose.
Well, I was thinking in terms of things like mammograms. If there was a mobile something that could go to Crane or somewhere that maybe didn't have a day-to-day.
Well, I think that would be a good project to look at in the future. I mean, anything is really possible. I've been here only a short time and sort of looked at some of the needs and assessed the needs for women's health, and there are things that we can do and grow. And when I say grow, I mean find a targeted need and then sponsor a project or a fundraiser or something to support that in the local area.
Evolve with the needs.
Absolutely.
Is essentially what Dr. Mitchell was saying that Texas Tech had done since.
Well, we have we'll be having a 4th annual breast cancer awareness luncheon that the Laura Bush Institute hosts, and it's sponsored by two hospitals, two area hospitals, Midland Memorial and Medical Center Hospital, and by the School of Medicine. And we'll have our 4th breast cancer luncheon coming up October 5th. And that's one of the things we've done over the last 4 years.
That is, again, something just awareness, if nothing else.
And what the proceeds from that go to is actually sponsoring women who are uninsured getting mammograms. So women from the counties that are outlying and also from Midland and Odessa County can come and get their free mammogram screening. So that's one of the ways we can, we can reach out to the community that needs mammograms.
Well, that reminds me of the Vera West Women's Center in Abilene, and that's essentially what they are also trying to do, and it's been extremely successful.
Well, one of the other initiatives that we haven't started, but we will, is some lunch and learn seminars for women's health topics, and inviting the public, anybody who wants to show up, and we'll target, again, these specific women's health areas over maybe each quarter, and just have a lunch, brown bag lunch, and then have a speaker talk about a women's health issue.
And so do you take a lot of the students from the nursing school and use them in clinicals?
Well, right now there's a nursing presence in hospitals. We don't have nursing students in our building right now. There's a nursing school, but we do have medical students, and we have visiting medical students from other areas that spend time with us. We of course have 3rd year and 4th year medical students on campus that spend time with us too. So there's a lot of teaching that goes on, and then the doctors who work in the Midland facility also teach at the PA school and teach, there's a lot of cross teaching that goes on.
And as someone who's been in the profession for a while, are you seeing any changes in the needs out here in West Texas than what you saw in Houston?
Well, I have to tell you, it's remarkably similar. I mean, I was actually, the same problems here occur in the big cities. And so I think the difference is when you're in a big city, you have so many options to find so many different people that might be able to help you with a problem. And I think you're limited here because the size is a little bit smaller. So again, I think our purpose might be to bring some of those very esoteric type expertise to the region.
And one of the things that I'm very interested in as a college administrator is that we see poorer and poorer health and attention to health of our young students coming into college, and much more missing classes, not having a good attitude about themselves. And this all seems to come down to the fact that they've never really been trained about the importance of their health. We're going to have to take a break right now, but we're going to come back in a few minutes and continue this conversation because Dr. Chupp has she's sitting on a gold mine of information that is going to be become a very important part of our medical community in the Permian Basin. We'll be back in just a minute to finalize this conversation.
Stay tuned. West Texas View will be right back.